I have here with me Dr. Valerie Fagan, who's a professor of neurology and a neurologist. Valerie, what is a neurologist?
Neurologist is a physician specifically trained in diseases of the nervous system, that is, diseases of the brain, spinal cord, and peripheral nerves.
I've heard a stroke also called a brain attack. Is that similar to a heart attack?
Yes, some people call a stroke is a brain attack to emphasize the emergency it requires. Generally speaking, and in lay terms, stroke can be defined as an acute vascular injury of the brain.
And what types of stroke are there?
Depending on the mechanisms of stroke, stroke could be caused by blood clotting in the brain vessel, and it's called ischemic stroke. Narrowing of the brain vessels could also result in the ischemic stroke, which is caused by a lack of blood supply to the particular area of the brain. Other types of stroke are caused by rupture of the brain vessels, and if the blood from the ruptured vessel gets into the brain, it's called intracerebral hemorrhage, and if blood gets into the area surrounding brain, it's called subarachnoid hemorrhage.
I would imagine that the blood not going to provide oxygen and nutrients anymore to the brain cells would damage the brain.
Yeah, even a very short supply of the blood, 7 seconds break in supply, causes irreversible damage to the brain concerned.
We're all going to get old, so I take it we're all at risk of having a stroke. Can I prevent getting a stroke?
Yeah, this is a good news about stroke. Although it is very serious and debilitating disorder, it can be prevented in up to 85% of the patients. All it takes, or all it requires, is to know whether you are at risk of stroke, what are your risk factors, and then take appropriate measures to control your risk factors.
You talked about risk factors. What are those?
Yeah, the most common risk factors for stroke are elevated blood pressure, smoking, heart disease, diabetes, and high cholesterol.
And if I lower those, will I lower my risk of stroke?
Definitely, and very substantially. As I said, in 85%, so 8 out of 10 people can avoid their stroke at all.
What if I've already experienced a stroke? Can I prevent it happening to me again?
Yes, although people who have had a stroke, they are at the increased risk of recurrent stroke, and approximately 2 out of 10 people have a recurrent stroke within the first year after stroke, and 1 out of 10 have recurrent stroke up to 5 years post-stroke, and about 1 out of 20 people have a recurrent stroke thereafter 5 years. But there are certainly ways to prevent the risk of recurrent stroke. And first thing to know and to take care of is to know the cause of your stroke and to treat it appropriately, to correct it. For example, if the cause of stroke was the rupture of the aneurysm in the brain, or it was due to narrowing of the brain artery on the neck, for example, then you may be offered a surgery to correct these abnormalities. If the stroke was caused elevated blood pressure alone, then controlling your blood pressure adequately could risk your stroke very substantially.
Could lower your risk of stroke.
Yes. That's the first strategy to reduce the risk of recurrent stroke. Secondly, you should certainly adhere very closely to the recommendations given to you by your doctor. taking medications regularly without any breaks, even if you feel perfectly well and think you don't need any more medications, don't stop taking medications unless you're advised to do so. And secondly, or third, you should control your other risk factors of stroke. The risk factors I mentioned before: elevated blood pressure, high cholesterol. You should certainly give up smoking, control your heart disease if it is possible, or as much as possible.
If I'm at a social event like a barbecue and I notice somebody is feeling unwell and I suspect they may be having a stroke, is there any tests that I can do?
Yes, in the case of severe stroke, it is pretty obvious that the patient has a stroke if you can observe obvious signs of weakness in the arm or leg on one side of the body, lost consciousness or lost speech. Then the diagnosis is usually not a problem, and most people recognize these symptoms as a stroke and seek immediate medical attention. The problem arises when these symptoms are subtle or transient in nature, resolving very quickly, just within few seconds or minutes. And this is the problem to diagnose these symptoms. There are a couple simple tests that everybody can use to diagnose the subtle symptoms of stroke. For example, you may ask the person to raise his or her arms to the level of the shoulder and shut the eyes. And if one of the arms drifts down, it means a weakness in this arm. And this may be a symptom of stroke. You may also ask the person to say a simple sentence, and if the speech is slurred, or the person cannot repeat the sentence, or if the person cannot understand your request, it may also be a symptom of stroke. Then you may ask the person to smile, and if one half of the face is droopy, then it is also may be a symptom of stroke. So in all these symptoms happening, and you can observe the symptoms, even if you are not certain whether it is stroke or not stroke at all, you should seek immediate medical attention right away.
What about if a person is experiencing a very severe headache? Could that be related to stroke?
Yes, very severe, unusually severe, or unusual pattern of headache could be a symptom of stroke without any other symptoms, just severe, unusually severe headache. It may be a symptom of one of the most devastating types of stroke called subarachnoid hemorrhage.
I've heard the expression time is brain. Could you please elaborate what that means?
Yeah, the time is brain indeed, and the lost time often means the lost brain. If any symptoms of stroke happening, or you just suspect a stroke, you need to get to the hospital as soon as possible.
So you don't contact your GP or ring a family member, you call an ambulance?
You call an ambulance right away and get to the hospital.
If a person is experiencing a stroke, what are the types of things that they may feel? What are their symptoms?
There are some symptoms of stroke which are called warning signs. They may precede stroke or may be the symptoms of developing stroke. And most common such symptoms are sudden loss of numbness or weakness of the arm or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden loss of balance, coordination, dizziness, sudden loss of swallowing ability, sudden troubling of seeing in one or both eyes, and as I said before, sudden, unexpected, or unusually severe headache of no known cause.
I've been told that if you have a stroke on this side of your brain, that you can lose the movement on the opposite side of the body. It seems a bit strange to me. Why is that?
Yeah, it is the way how the body functioning is organized. So in most cases, right side of the body movement functioning is controlled by the left brain, and the other way around. Left side of the body is controlled by the right brain. But there are parts of the brain that control both sides, and those parts are called brainstem, or middle part of the brain.
I've heard that people can feel unwell and get symptoms a bit like a stroke, but it doesn't last, that it's called a TIA or a mini stroke. What do they mean by that, and does it really matter?
Yes, there is a term called transient ischemic attack, or TIA, or some people call it minor stroke. This is referred to symptoms of acute vascular injury of the brain which last less than 24 hours. In most cases, these symptoms last just a few seconds or minutes, but they should not be ignored because they often are first warning signs of stroke that often lead to stroke, and take timely measures to control TIA, understand the underlying cause of TIA, could prevent stroke from happening. So it's very important to recognize these symptoms and get immediate medical attention.
Professor Fagan, thank you very much.
Thank you.